Welcome to this BSPARI element brief training on preference assessments, presented by DBHDS Behavior Network Supports. The purpose of this training is to support behaviorists providing therapeutic behavioral consultation through the waiver system and their efforts to navigate the DBHDS DMAS Practice Guidelines for Behavior Support Plans and the accompanying Behavior Support Plan Adherence Review Instrument, also known as the BSPARI. The goals of this training are to define preference assessment, become familiar with areas addressing preference assessments in the practice guidelines and BSPARI elements, learn the relevance of preference assessments in behavioral services, identify examples and non-examples of plans meeting the relevant BSPARI elements, and access research articles and other resources on preference assessments. Let's start by defining preference assessments. Preference assessments can be defined as a collection of procedures that could be used to identify whether one item is more preferred than others. Preference assessments can fall into two categories: direct and indirect. Here are some examples of those two categories of preference assessments. The DBHDS DMAS Practice Guidelines for Behavior Support Plans outline the required content areas and associated minimum elements for behavioral programming through the Therapeutic Consultation Waiver Service. Information gathered during a preference assessment can satisfy the criteria for 4 different elements in the person-centered section of the BSPARI. Those are the preference assessment information and results, what activities are enjoyed and sought by the individual, particular aversions, dislikes, and who in the individual's life is especially preferred. To earn a check for the preference assessment element, the BSP must include information about both the type and results of preference assessment conducted to determine what may function as reinforcement for the individual. Notice that the type of preference assessment needs to be listed or described. Vieiras-Ortega and colleagues conducted a review of the literature on preference assessment. Their research found that preference assessments are important because preferred items function as reinforcers. Using preferred items as reinforcers in interventions can establish new skills, increase engagement in academic activities, and reduce problem behaviors. Preference assessments are adaptable to a large variety of stimuli, including sensory, leisure, edible, social, and academic. Now let's look at a person-centered information section of a fictional behavior support plan. The profiles in this video are for illustrative purposes only and do not represent an actual person. In this example, Raj's communication modality, routines and current schedule, and his participation in treatment planning are all clearly present. This statement meets the criteria for strengths and positive contributions. And there is information about cultural considerations. These items all score checks. While this statement mentions Raj spending time with others, it does not specify whether those people are preferred. There is also no information about his preferred activities, any preference assessments conducted, or aversions and dislikes. Therefore, those elements would all score an X on the BSPARI, and this plan would score a 0 for the person-centered information. Now let's look at a good example with another fictional BSP. In this example, the author of this plan indicated that interviews were used to gather information about Leonard's preferences, and then listed those preferences, which earns a check for preference assessment information and results. The activities listed earns a check for what activities are enjoyed and sought by the individual. During the preference assessment interview, the clinician also gathered information about Leonard's dislikes, which earns a check for particular aversions and dislikes. This process also allowed the clinician to gather information about preferred people in Leonard's life, which earns a check for who in the individual's life is especially preferred. This plan has earned all possible points for the person-centered information section. Here are a few of the different preference assessments we discussed earlier. These can be accessed through the reference articles on the last slide. Thank you for taking the time to review this training. Please explore our website for additional resources and training opportunities, as well as the BSPARI and the DBHDS DMAS Practice Guidelines for Behavior Support Plans.